Yes, so this field of using PD-L1 as a predictive biomarker in immuno-oncology for lung cancer specifically is still really in flux. And the complex FDA-approved indications that we have, we're seeing are now dependent on line of therapy. They're dependent on histology, and the key takeaway that we learned from this study that wasn't known before was that if you have high PD-L1 versus low PD-L1, that really makes a difference if you have non-squamous histology. But as you mentioned in your question, for patients that have squamous histology, it didn't really make that much of a difference. I mean, there was 2 months longer about life expectancy if you have squamous with high PD-L1 compared to low, but it wasn't a significant difference as compared to non-squamous. It was about 8 months longer life expectancy if you have high PD-L1. But one of the challenges and opportunities that we have with biomarkers of this type are that when in the stains, we have this continuous numeric value, so a percentage stains. And in this study, we considered you to have a high value if it was more than 50% and a low value if it's less than 50%. But some other studies have shown that in second-line therapy, even having 1% at least stain can be a meaningful predictor. So it's hard to answer your question for every single threshold, because in this study, we only looked at the 50% threshold, and it could be there's benefit at different ones. But I think the real interesting opportunity to answer your question would be a study in the future that would do a comparative effectiveness analysis of different treatment types for those squamous patients. In this study, one of the inclusion criteria was that everyone was using pembrolizumab. But if we're seeing that for these squamous patients, PD-L1 is not a meaningful predictor, a really interesting study would be, okay, well, if we looked at all the squamous patients with non-small cell lung cancer and all of the different treatments, and designed a rigorous study, is it that, patients with squamous histology do better on a different treatment type than patients with non-squamous histology? And are there other meaningful interactions with the choice of treatment and the biomarkers? So a lot of, it just opens up more and more questions for us to tailor, this type of personalized treatment recommendations. We don't have data really to show us that from clinical trials that would let us know whether or not these drugs are actually able to give benefit in terms of extending the life of patients in the last 30 days. And really that's because the eligibility criteria for the clinical trials for these drugs are almost always include that that a part of the patients need to have an expected life of at least 6 additional months. And so that leaves us really with not really knowing. And again, an opportunity, I think, for more real world evidence, observational studies in the future. If we're not going to be able to have that good question answered through a clinical trial, you know, it would be meaningful to learn it some other way.